Have you ever woken up in the middle of the night with your heart racing for no apparent reason? Or perhaps you've started your morning with a pounding headache, feeling unusually tired despite getting a full night's sleep? You might dismiss it as stress, poor sleep quality, or just an exhausting day before. But what if these subtle signs were actually warnings from your heart? Nighttime hypertension, a condition most people are unaware of, could be one of the most dangerous threats to your cardiovascular health. Unlike daytime high blood pressure, which often comes with obvious symptoms, elevated blood pressure at night operates in silence, slowly increasing your risk of stroke, heart failure, and even sudden death in your sleep. According to research from the American Heart Association, having high blood pressure at night is even more dangerous than having it during the day. But why does this happen? And more importantly, how can you detect and control it before it's too late? Let's dive into the science behind nighttime hypertension and discover the steps you need to take to protect your heart while you sleep. Under normal conditions, blood pressure exhibits a diurnal rhythm. During the night, while sleeping, blood pressure decreases by around 10 to 20%, a process known as the nocturnal dip. This reduction is crucial for the heart and blood vessels, giving them the opportunity to recover after a day of activity. It allows for vasodilation, the relaxation and widening of blood vessels, which helps reduce the load on the heart. This drop in blood pressure is typically seen during the deeper stages of sleep, when the body's parasympathetic nervous system becomes more active. However, individuals with nocturnal hypertension fail to experience this drop, or, in some cases, their blood pressure rises during sleep. This disrupted pattern of blood pressure regulation during sleep has profound implications for health. The risk of nocturnal hypertension. When blood pressure remains elevated at night, it results in continued cardiovascular stress. The risks associated with nocturnal hypertension are far-reaching and potentially life-threatening. 1. Increased stroke risk. Persistent high blood pressure at night can contribute to the formation of plaques within blood vessels, particularly in the brain. Over time, this can lead to blockages, resulting in ischemic stroke. Studies have shown that those with non-dipping blood pressure, where the blood pressure does not decrease during sleep, have a significantly higher likelihood of experiencing strokes, as compared to those who experience a natural drop in blood pressure during sleep. 2. Heart attack and heart failure. Nocturnal hypertension places additional strain on the heart. Without the natural rest period provided by a decrease in blood pressure, the heart continues to work harder than necessary. This increases the likelihood of developing coronary artery disease, which can eventually lead to a heart attack. Furthermore, the ongoing elevated pressure can result in heart failure, a condition where the heart becomes less efficient in pumping blood. 3. Chronic kidney disease and other complications. The kidneys are sensitive to blood pressure changes, and sustained high pressure at night can damage the blood vessels in the kidneys, leading to chronic kidney disease, CKD. The American Heart Association, has identified a strong link between nocturnal hypertension and kidney damage. As the kidneys are integral in regulating blood pressure, any damage to them further exacerbates blood pressure control, creating a dangerous cycle. 4. Cerebrovascular damage. Hypertension at night is also closely associated with an increased risk of cerebrovascular diseases, including conditions like vascular dementia. The sustained high pressure can cause damage to the blood vessels in the brain, reducing the brain's blood supply and leading to cognitive decline over time. Key factors contributing to nocturnal hypertension. There are several factors that can contribute to the development of nocturnal hypertension. 1. Obesity and sleep apnea. Excess body weight is a primary risk factor for sleep apnea, a condition where breathing is briefly interrupted during sleep. Sleep apnea causes hypoxia, low oxygen levels, which in turn increases blood pressure. Additionally, people with obesity often experience interrupted sleep, which disrupts the body's ability to regulate blood pressure during rest, increasing the risk of nocturnal hypertension. 2. Diabetes and kidney disease. Individuals with diabetes or chronic kidney disease have a higher likelihood of experiencing nocturnal hypertension. These conditions impair the body's ability to manage blood pressure effectively, making the natural nocturnal dip less pronounced. In addition, both diabetes and kidney disease contribute to the thickening of blood vessels, which increases vascular resistance and elevates blood pressure. 3. Diet and lifestyle factors. High sodium intake is a major contributor to elevated blood pressure. Excessive salt consumption leads to fluid retention and constriction of blood vessels, which elevates blood pressure. Consuming salty foods in the evening can exacerbate blood pressure spikes at night. Similarly, alcohol and caffeine are stimulants that can increase blood pressure and disrupt sleep quality. Both should be avoided in the hours leading up to bedtime. 4. Stress and anxiety. Chronic stress can have long-term effects on blood pressure regulation. The stress response activates the sympathetic nervous system, causing an increase in heart rate and blood pressure. Individuals who experience high levels of stress may find that their blood pressure remains elevated even during the night, particularly if they struggle with anxiety or depression. Diagnosis of nocturnal hypertension. Diagnosing nocturnal hypertension requires monitoring blood pressure over an extended period, as a single measurement will not capture the fluctuations throughout the day and night. The most accurate method for diagnosing nocturnal hypertension is ambulatory blood pressure monitoring, ABPM. This technique involves wearing a cuff that automatically takes blood pressure readings every 15 to 30 minutes over a 24-hour period, including during sleep. This method allows healthcare providers to detect non-dipping patterns or morning hypertension, which can indicate elevated risks for cardiovascular events. ABPM provides a comprehensive picture of how a person's blood pressure behaves throughout the day, offering crucial insight into whether nocturnal hypertension is present. This method also enables early detection of early morning surges in blood pressure, which are especially hazardous, as they occur when the body transitions from rest to activity, putting extra strain on the heart. Managing nocturnal hypertension. Managing nocturnal hypertension is critical for reducing the risk of long-term cardiovascular damage. Effective management typically involves a combination of lifestyle modifications and, if necessary, medication. 1. Lifestyle changes. Weight management. Maintaining a healthy weight is one of the most effective ways to reduce blood pressure, especially for individuals with obesity. Dietary adjustments. Reducing sodium intake and adopting a DASH diet, dietary approaches to stop hypertension, can help lower blood pressure. Limiting alcohol, caffeine, and heavy meals before bed can prevent disruptions in sleep and blood pressure regulation. Regular exercise. Physical activity strengthens the heart and vascular system, improving overall blood pressure control. Aiming for at least 30 minutes of moderate exercise on most days can have a significant impact on nocturnal hypertension. 2. Improving sleep quality. Sleep hygiene. establishing a consistent sleep schedule, creating a comfortable sleep environment, and avoiding electronics before bed can improve the quality of sleep and facilitate better blood pressure regulation. Treating sleep apnea. If sleep apnea is contributing to nocturnal hypertension, CPAP therapy, continuous positive airway pressure, is the primary treatment. This device keeps the airways open during sleep and reduces the occurrence of hypoxia, thus preventing blood pressure spikes. 3. Medication. For some individuals, antihypertensive medications may be necessary to control blood pressure throughout the day and night. Medications such as ACE inhibitors, angiotensin receptor blockers, ARBs, and beta blockers can help manage blood pressure and protect against cardiovascular events. Diuretics, which help the body eliminate excess salt and water, may also be prescribed to prevent fluid buildup that contributes to elevated blood pressure. For monitoring and regular check UPS. Ambulatory blood pressure monitoring should be done regularly to track the effectiveness of any treatment and ensure blood pressure remains well controlled, especially at night. Regular follow-up with a healthcare provider is necessary to assess overall cardiovascular health. The importance of addressing nocturnal hypertension. Understanding and addressing nocturnal hypertension is critical to maintaining long-term heart health. Blood pressure during sleep is as important, if not more so, than daytime blood pressure for overall cardiovascular well-being. By prioritizing sleep health, weight management, dietary changes, and stress reduction, individuals can significantly reduce the risk of heart disease, stroke, and other cardiovascular complications. As research continues to underscore the risks of nocturnal hypertension, early detection and appropriate management will be key in reducing its impact on global cardiovascular health. Ensuring a healthy heart requires paying attention to the factors that influence blood pressure at night because, ultimately, the health of your heart depends on the health of your sleep. High blood pressure at night is a hidden health problem that many people are not aware of, but it can have serious consequences for the health of the heart and other organs in the body. By proactively controlling your blood pressure, making lifestyle changes and maintaining a healthy diet, you can reduce this risk. Pay more attention to your sleep, because it is an important time for the body to recover and protect the heart. If you find this article useful, don't forget to share it with your friends and relatives to protect your heart health together. Let everyone understand the importance of blood pressure and simple but effective preventive measures for a healthier heart.